Welcome viewers globally and friends and colleagues. And welcome my colleague Dr. Danny Pillay for the next series of discussion, and where we're going to highlight specific topics in restoration of optimal health. And the first topic that we for this day we will delve into lifestyle in relation to blood sugar control, what is widely known as diabetes. Good afternoon, Danny, and welcome to the next discussion we're having today.
Good afternoon, Reggie, and good afternoon to your viewers. I'm very pleased to be here.
Thanks, Danny. Let's talk about the principle of diabetes. Why is diabetes becoming so prevalent, not only from a South African perspective, but almost globally, that the incidences are increasing and the percentage of patients that we're seeing are no longer in the age groups of 60 and plus, but we're seeing the much younger population.
Yes, so diabetes, and it's a broad term, but we talk about generally what is called type 1 and type 2 diabetes. And type 1 is usually an autoimmune basis and usually occurs in a much younger age, where the person's body's insulin on the cells manufacturing attacked by the immune system, so they don't make insulin. So that's the type 1, and they need insulin support. But what you're referring to most is what the type 2, what would be the adult onset diabetes. And that used to be in the sixth decade, in the 60s and so. But we are finding people already in their 20s and 30s developing that type 2 diabetes. And that's usually got to do a lot more with lifestyle. There's a genetic component, but certainly the modern lifestyle is a great contributor. And you're quite correct. It's over 700 million people in the world afflicted. And the figure is that you're going to have 1 in 5 people in the world in the next 2 to 3 decades afflicted by diabetes. So really it's a lifestyle disease, and it's really a biomarker for the way we live our lives.
Danny, is it prevalence in certain specific nationalities or countries, or is it a global kind of incidences that are increasing from a younger population?
Well, it used to be, in fact, probably one of the epicenters of diabetes used to be Durban, KwaZulu-Natal, South Africa, in the Indian population. A high incidence, and for years it's been that, and probably met by Afrikaners and getting greater in the other race groups. But for probably the last 3 or 4 years maybe now, we've been surpassed by the Mexicans, who have surpassed the incidence of diabetes in the Indians at Durban. Primarily, again, to the lifestyle, because of all the cornstarch and the conserves that are being dumped from the American food process into Mexico, where the cheap foods are full of glucose, fructose, corn-based and sugar-based foods. So we're finding world over. We're finding countries in Sudan, Ethiopia, with the kind of refined foods, refined maize, the genetically modified food. Diabetes is becoming a pandemic.
Then there is a percentage of children who are affected, what we know as juvenile diabetes. What's the prevalence of that?
So, as I said, you have to distinguish between the children that are with type 1 diabetes. I'm not sure exactly the incidence, but it would be somewhere like 1 in 2,000, 1 in 3,000 cases. That is a much rarer form. But what we're finding so much, not more than diabetes, but pre-diabetes in children, meaning they're having the truncal obesity, they're having higher than normal glucose levels. This is going to predicate the effect of having diabetes later in life. So we're finding a lot of children today sitting with what is called either being overweight or obese. And typically overweight being from 25 to 29 on the BMI, stands for body mass index, where you take your height and you divide it by your weight divided by your height squared. So you take your weight, say 60 kilos, and you're 1.5 meters, divide by 1.5 meters, divide by 1.5 meters again. And so anything above 30 is obesity, and above 35 is grossly obese. So we're finding a lot of young children are far in excess weight, and that's just going to set them up for diabetes. And there are, of course, young children now who are developing diabetes.
There is a discussion I have with many of our patients and colleagues about, is diabetes genetic or is it more lifestyle?
Well, it's both. So the risk factors for genetics is usually for adult onset diabetes, there's either a parent or a sibling over 45 years of old having symptoms of pre-diabetes, meaning raised sugar levels, not yet be diabetic, a sedentary lifestyle, not exercising, a bad diet, and for women when they have what is called gestational diabetes, when they get diabetes when they're pregnant. And it's usually resolved after delivery, but that woman is higher risk to developing diabetes. So we know that. But we also know that there's a lifestyle component because people who are diagnosed with diabetes, depending on the levels, if you start introducing a dramatic lifestyle change in terms of what they eat and exercise, you can reverse a lot of pre-diabetes.
How would you highlight the context of what you just said now, gestation diabetes? Is there a guideline for mothers who are intending to be pregnant to prevent this happening?
Well, most certainly, if you are planning to be pregnant, it's obviously lifestyle, exercise, reducing stress levels, all of these things will contribute. Of course, there's some susceptible groups that will develop it. And the other thing that's important to know is that if you've been two things, having a very large baby, what we call a macrosomal baby, more than 4.22 kilograms, the mother is at risk and that child is at risk for future diabetes. So it's lifestyle, it's certainly exercise, diet, you can mitigate against that. But there is a genetic component. Some women, despite doing all of that and being fit and healthy, may still develop.
Danny, I would like to highlight about diabetes in relation to dental health. And in my practice, which is very integrative in my approach, and I see lots of patients now who are between 20 and 40 have early periodontal disease, which is gum and bone disease, loss of soft tissue and hard tissue. How you relate diabetes to the oral health conditions from your experience?
So, firstly, one of the things with diabetes in itself, of course, it's a raised blood sugar, but it has what is called target organs or end organ damage. So, when you've got high glucose levels, your insulin is supposed to modulate and act like the key to get the glucose to enter into your cells. But when that's not working properly, sugar will dump into certain cell types. So one of them is your retina that's behind the back of your eye that does the seeing. They don't need insulin. So sugar will dump there. Therefore, the diabetics will have blurry vision. They will develop new blood vessels. So often you hear the patient went to have some laser for their eyes. It will damage the heart muscles and it'll damage the kidney. That's what we know. But it also has other effects. Obviously, loosening the gum tissue, loosening the tendons. And you would see with your patients a lot of having gum disease. Mobility is an issue. The tooth becomes more mobile. Then when you have diabetes, you have higher incidence when you have injuries, whether it's gum injuries, that infections don't clear. You find wounds don't heal that well. You find that they give a higher level of acidity. So all of these things will impact on gum health and oral health in general. You find people that are prone to diabetes or will get diabetes have something called acanthus nigrans, which is like a skin disorder. So it has an effect on the connective tissue, on the skin tissue. So you would find many a patient with diabetes starts then, if there's not control, start losing teeth. And I'm sure you've seen that in practice.
Yes, and Danny, it's also that I've seen in many patients diabetes in relation to periodontal disease, but also having a cardiovascular component effect, what they call subacute bacterial endocarditis, right? And I don't think that people and patients generally relate that cardiovascular challenges they have in relation to diabetes and gum and bone disease.
So subacute bacterial endocarditis is just one thing. It's not all cases that can leave vegetations on your blood in your valves. That's a small percentage of them, but the majority of them, when you have local inflammation in the gum tissue and the periodontal tissue, it impinges on the rest of the inflammatory cascade on the rest of the body. And it's on the blood vessels. It's on what we call the tunica intima, the inner lining of the arteries and the blood vessels. In general, the heart. So it then predisposes to heart disease because it's all part of an inflammatory cascade. So certain teeth, especially the molars and the premolars, have a higher relationship to cardiovascular disease.
Danny, would you say that lifestyle disease in relation to what we know as junk foods, a high carbohydrate diet, has a direct impact in relation to diabetes and gum and bone diseases in the mouth?
Most certainly, other than the local effects of eating high carbohydrate foods and the local conversion of glucose and the damage that will happen. But if you have raised blood sugars, then will certainly then trigger that cascade of inflammation, poor immune function. The higher your sugar, the lower your immune function. And then your connective tissue weakness that happens. So all your barriers that protect you, whether it's your mouth and your mucous membranes in your mouth or your skin, you're going to be at risk. So, diabetes is risk to gum disease, but it's also risk to developing things like fungal disease. Or you'd find this high risk of thrush. So when people experience things like diabetes and whether it's HIV, anything that compromises the immune system, you then get what is called an opportunistic infection. And the commonest opportunistic infection in humans is Candida albicans. So as commonly known as thrush, whether it's oral thrush or vaginal thrush or of the alimentary or the gut.
Danny, we are delving into that, the impact of diabetes in relation to all the organs of function in the body, right? Being an inflammatory response and inflammatory condition, it obviously translates into every part of the body.
Absolutely. It's part of what is called metabolic disease. So this includes diabetes, hypertension, cholesterol, and the like. So the mechanism, what happens is how the linings of the body, in this case the arteries, how they, under influence of high sugar levels, gets inflammation and this damage starts happening. So typically, the diabetic is going to be a risk to cardiovascular disease. So inflammation, I try to explain to people, is that it's inevitable to have inflammation, but it should be degrees of it. When there's too much, we can't control. So I use that example of the old day paraffin lamp. And I use that example all the time. So if you light it, you get clear light, but as it burns, it gets soot in it and it gets black. That's kind of what goes, and it blocks eventually. The thing that gives the light is the thing that blocks the light. So we have a little bit of inflammatory substance the body should be able to clear. But when we have bad lifestyles, this inflammatory response is overwhelming, and then it starts causing destruction and damage. So you were going to get damage off the arteries, but you're going to get damage off the nerves. So a diabetic's going to end up with what's called peripheral neuropathy. They get numbness and tingling of the fingers in the joint. Eventually, they get what is called paresthesia. They feel like the sand between their fingers. They feel numbness. And when the nerves get damaged, so typically they'll get a nick on the toe and they won't know it. And it takes long to heal. And then they can pick up a big infection, and then if it really gets bad, you hear of diabetics, then it gets a gangrenous toe and they have to be amputated. This is a series of events that end up in the diabetic. Of course, the inflammation can happen at the kidney level. So many diabetics unmanaged are going to end up with kidney dysfunction, which can relate to having later dialysis and the like. So it has a myriad of effects. It can accelerate other damaging things to the brain, for example. So too much of sugar in levels can get what is called glycosylation of the brain. So it changes how people's moods work, their memory recall, their brain function. So it really is a systemic disease because, of course, sugar levels feed the entire body. And if it's out of balance, just try and imagine if you had too much power running through one of your circuits. It's going to blow it. So it's a similar kind of thing here. High levels of sugar going to be detrimental to the body.
Then in the context of South Africa, that we have a very high percentage of youth in our population sector, which is known as, I'm referring to the population as Generation Z. What advice you think we could give the Generation Z to arrest the so-called the debilitating effect of diabetes and ensure that they become optimally functioning as future leaders in our country?
Well, I hope Gen Z will listen to our advice because every generation thinks they know better for the next. But from the data we have, the things they need to do: firstly, eat healthy food. Avoid the junk food. Okay? So, eat that very sparingly. Exercise. Have regular medical checks for your levels of sugar. And something we measure what is called the HbA1c. So when we measure your glucose, we're measuring real time what is your glucose level in your blood in that moment, which might be normal, but you could have had a high reading before. So when we measure the HbA1c, that's when glucose attaches to the red blood cell, and that's irreversible. So when we measure HbA1c, we're looking at your average glucose levels in your blood for the last 3 months. So it's a better advice. So if you've got a family member who's got diabetes, you should regularly monitor it because you won't know when you get it. And often when you've got things that either what we call polyphagia, getting very hungry, polyuria, where you have to urinate a lot, polydipsia when you're very thirsty, you're losing a lot of weight easily, you constantly tired. These are factors that can, or features that portend towards diabetes. You need to have it checked. But most importantly, eat properly, regular exercise, drink water than having all these fizzies and all these chemical drinks. That is the start for them to start reversing this incidence. I wish they would listen.
Thanks, Danny. And we hope that not only the Generation Z, but we hope that the parents who bring the children up into the world would tune into the aspect of eating healthy, living healthy, and the most important thing, that do everything within limits. Thank Danny, and we look forward to the next series coming up on the various lifestyle topics. And we wish the audience well, and in terms of you looking at and delving into the aspect of health and prevention. Thank you.
Thank you.